Am I the only one that didn't know gonorrhea is on the rise? Seriously, it feels like every time I turn on the news or scroll through my feed, there's another story about STIs making a comeback, but for some reason gonorrhea doesn't get talked about as much as it should. Maybe it's because people feel awkward, or maybe it's just not on our radar. But trust me, it's time we start paying attention. So let's talk about what that actually means. Why is gonorrhea suddenly making headlines, and what should you know to keep yourself safe? Whether you're sexually active or just want to be informed, this is something that affects everyone, regardless of age, gender, or background. Gonorrhea is a common sexually transmitted infection, or STI. In fact, it's one of the most frequently reported STIs worldwide. The numbers are climbing, especially among young adults and teenagers, but anyone who is sexually active can get it. The bacteria that cause gonorrhea, called Neisseria gonorrhoeae, are spreading faster than ever, partly because people aren't always aware of the risks or the symptoms. And here's something important: gonorrhea doesn't discriminate. It can affect both men and women, and it doesn't matter if you're straight, gay, or anywhere in between. If you're having sex, vaginal, oral, or anal, you could be at risk. What makes gonorrhea especially tricky is that you might not even know you have it. That's right, sometimes there are no symptoms at all. You could feel totally fine and still be carrying the infection, which means you could accidentally pass it on to someone else without realizing it. That's why regular testing is so important, even if you feel healthy. But when symptoms do show up, they can be pretty uncomfortable. For men, it might mean a burning sensation when you pee, or a white, yellow, or green discharge from the penis. Women might notice increased vaginal discharge, pain during urination, or even bleeding between periods. Sometimes the infection can spread to the rectum or throat, causing pain, itching, or soreness. Here's the deal: gonorrhea isn't something you want to ignore. The good news is that gonorrhea can usually be treated with antibiotics. But here's the catch: if you leave it unchecked, it can cause some serious health problems. And with antibiotic resistance on the rise, it's more important than ever to catch and treat gonorrhea early. If you don't get treated, gonorrhea can lead to long-term complications. We're talking infertility, chronic pelvic pain, and even an increased risk of getting or spreading HIV. In women, untreated gonorrhea can cause pelvic inflammatory disease, which can damage the reproductive organs. In men, it can lead to painful conditions in the testicles and even affect fertility. And remember, you can also pass the infection to your partner, which just keeps the cycle going. So, what can you do to protect yourself and your partners? The first step is knowing how gonorrhea spreads. It's passed through sexual contact, vaginal, anal, or oral sex, with someone who has the infection. Even if they don't have symptoms, they can still pass it on. That's why it's so important to have open conversations about sexual health and to get tested regularly. The best way to lower your risk is to use protection like condoms or dental dams every time you have sex. Condoms aren't just for preventing pregnancy. They're your best defense against STIs like gonorrhea. And don't forget about regular STI screenings. Many clinics offer confidential, affordable testing, and it's a simple way to stay on top of your health. And don't forget, being open and honest with your partner is key. Talk about your sexual history, ask about testing, and make sure you're both on the same page when it comes to protection. It might feel awkward at first, but it's a lot less awkward than dealing with an STI later on. If you do test positive for gonorrhea, don't panic. It's treatable, and your healthcare provider can help you get the right medication. Just make sure to finish all your antibiotics even if you start feeling better, and let your recent partners know so they can get tested too. That way, you help stop the spread and protect your community. Remember, taking care of your sexual health is super important. It's not just about avoiding infections. It's about feeling confident, empowered, and in control of your body and your future. So stay informed, stay protected, and stay healthy. Make sexual health a regular part of your self-care routine, just like eating right or exercising. The more you know, the better choices you can make for yourself and your partners. That's it for now. Thanks for taking the time to learn about gonorrhea and how to protect yourself. Hit the like button if you found this helpful, And don't forget to subscribe for more quick health tips. If you have questions or want to learn about other health topics, drop a comment below. Your health matters. Let's keep the conversation going.